Just to add some seasoning to your story, don't bother them now because they do have a lot of patience. But if you know, hey everybody, Dr. Z here again, back for another video. Today I want to talk about your relationship with your doctor and how to build a good one. Let me tell you one thing: you want to have a good relationship with your doctor. Period. You want someone who's going to go above and beyond for you, who's going to talk to insurance if they need you to, who's going to go that extra mile, because in this healthcare system, you want someone on your side. So, your relationship with your doctor. This is a little tricky because I think patients sometimes put doctors on a pedestal, like, we are the doctor, we know everything. You know, we have a lot of information, we have a lot of knowledge, specialized knowledge, this is true. But at the end of the day, we're still human beings with biases, and we're fallible. We can be wrong. What a lot of doctors will not admit to you is that we do have favorite patients. And it's not that we won't take care of everyone. It's that, like, there are certain names that, like, if you tell me that this patient is in the hospital, I'm gonna go check on them. You know, I'm gonna make sure that everything's going well with them. And you want to be that patient. You want to be that patient who has an extra set of eyes, who has an extra person on their team going to bat for them. So how do you become that patient? Well, there's a couple things. One, you need to follow up with your doctor. Like, you need to check in with your doctor on a regular basis. You just have to. Like, the ways that we're able to take care of you is if we know you and we see you regularly. So coming in to see your doctor, you know, once every year, once every 6 months, like, just to check, especially if, you know, if you're more advanced in age, just check in, because that way we get to know you, we get to see you more frequently, and if we hear your name, we won't have to look through your chart to remember who you are. You know, you want us to be like, all right, Miss Johnson is in the hospital. I'm gonna go see her if I get a chance. If I get 10 minutes to go, I'm gonna go see her. Have a conversation with them. You know, when you're explaining your symptoms, when you're explaining your issue or whatever you came in for, you know, add some personal stuff. Make it a conversation. Talk about your family. Talk about your work. Talk about what you're going through at that moment. Just to add some seasoning to your story, because unfortunately we do see, you know, patients every 10-15 minutes. So if we have to see 20 people in a day, we're not necessarily going to remember every single detail about everyone. But some people also fall into the trap of trying to be the good patient and trying to do what the doctor wants them to do. And, like, yes, we have recommendations, and yes, we generally want you to follow them, but what we really want is transparency. We want you to be honest with us and tell us, what are your reservations about this treatment? Why don't you think you'll be able to make this change? Ask us questions. Are there alternative things? Like, we want it to be a dialogue. We want it to be teamwork. Like, we are your doctor, yes, but you are the expert on your life. So tell us, so that we can work together. And that's part of the relationship building. If your healthcare provider has online messaging interface, some sort of email or some sort of inbox system where you can message your doctor directly, utilize that, because oftentimes you can save yourself a visit and your doctor will tell you, actually just make a visit for this and we can talk about it more extensively. That also is part of relationship building. Don't bother them now. Because they do have a lot of patience. But if you have a legitimate question, we'll welcome that for sure. Some doctors' offices will have, multiple healthcare providers that will sort of step in and see other doctors' patients or other NP's patients, which is fine if you have like an urgent issue and you need to be seen right away. But if it's non-urgent, I actually encourage you to wait the extra 2 weeks or extra 3 weeks to see the provider who you've regularly been seeing, just because it's better for the relationship. If you're seeing a different person every time, you're not really able to build that continuity, which is fine. Like, if you broke your arm and you need to be seen urgently, see whoever will see you. But if you're going for like a yearly maintenance check, or you've just been having some vague symptoms and you're like, maybe I should just go check this out, I think it's worth it to see the doctor who knows you already. Basically, doctors are humans too. We're people, we're trying to help out. If you build a relationship with us and we like you, you like us, we show interest in you, you show interest in us, it'll work better. It's kind of like the same thing with like, if you're at a restaurant, right, you're not going to like be mean to the person who's making your food. Like, it's just, it doesn't make sense. Like, just don't do it. Treat it like a relationship. Treat it like you're getting to know someone. You're allowed to, I mean, different providers have different levels of comfort with this, but you're allowed to ask questions of your doctor too, or just find ways to relate to the person, because the more you relate to the person, the more likely that, that relationship will be a positive one. All right.